two cities in South Carolina are among the highest in the country for rising rates of sexually transmitted diseases. Well, here to shed some light on why this disturbing trend is Dr. Catherine Richardson, Lowcountry Regional Medical Director for the State Department of Public Health. Great to have you with us and to help us kind of break down some of these numbers. We're seeing some numbers ticking up while others are going down, which we really tend to like to see. But I was surprised to learn in top 100 U.S. cities that Columbia is really ranking kind of high when it comes to syphilis, gonorrhea, chlamydia infections. Why do you think that is?
Well, I'm the medical director for the Lowcountry region, so the 11 states that are in sort of the bottom quarter. Those do not include Columbia, but I think a lot of the similar reasons that Charleston is on that list, coming in at 46 from 52 last year. Probably similar to why Columbia also is now at 14 this year. And I think there are probably a couple of different reasons for that. I think one is that we didn't see a lot of testing during the COVID-19 pandemic. We've certainly seen a lot of stressors in our community. And these numbers are following national trends, but particularly trends in the South. So many of those top cities on the list based on CDC data are in the South, where we see more stigma around talking about sexual health, less emphasis on sexual health when we go see our providers, and perhaps less testing as well.
And is it because we live in such rural areas that access to testing sites is somewhat a barrier?
Absolutely. Okay. Yes. Access can certainly be a barrier. So it starts with education, knowing that testing is important, knowing what risk factors sort of increase the need for testing, then accessibility for clinical services, including that testing is also certainly a big factor in South Carolina.
And you were mentioning the South in general, and I read that as well, that the South is kind of suffering from this statistic. But someone had mentioned that Charleston, being that it's so highly visited by travelers, people spending holiday here, do you think that that also is having somewhat of an impact, that maybe there's some activity going on because of the influx of people coming in, not necessarily those who live or are from here?
Well, certainly that could have an impact because of the, locals meeting those who are here visiting. The numbers do reflect where the residence of the person who's diagnosed, where they live. And so someone may have been infected in Charleston, but if they're from New Jersey, that case will actually be counted in New Jersey.
I see.
So we don't see as much of that effect because of visitors.
Okay, well, let's talk about numbers real quick. So since you're representing the Lowcountry, Charleston, so HIV cases, 140 currently is sort of the latest number, and you say that those take a bit longer to kind of amass the statistic to come up with something up to date. But chlamydia, gonorrhea, syphilis, there are treatments for all three.
They're great treatments for all three, but that must start with testing. So someone must know their status to be able to be treated for any of those infections. We also have a new prophylaxis. It's called DoxyPEP. Doxycycline is a common antibiotic. It's been around a long time. PEP stands for post-exposure prophylaxis. That can be taken after sex within 72 hours, greatly decreases the risk of chlamydia and syphilis, also gonorrhea. That's mostly for gay and bisexual men, but something that we do recommend folks talk to their provider about.
Absolutely.
If of interest.
We just have a couple of seconds left, and we've got testing going on. So can you give our audience just briefly where people can get tested?
Yes, so they can be tested at most health departments every day. We do have several free testing days coming up. And we also have $10 fast track testing for those who are asymptomatic every day. We do recommend appointments, but we try to fit
Sure.
in walk-ins.
Okay.
There's
But the resource is out there.
there's also many other resources in the community. We have a locator on our website to find free and low cost testing in our area.
Perfect. Dr. Richardson, thank you so much.
Sure. Thank you for having me.
We're back after this.